Pierre, you're head of a centre to develop best practices for health in Cameroon. Tell us just briefly what that does.
The Center for the Development of Best Practices in Health is aiming at building capacity for evidence to practices in healthcare, but also an evidence to policy making in Cameroon. Typically, we are planning to build human capacity for evidence to practices, to conduct health technology assessment, to also draft policy briefs, packaging summaries of evidence, and also to conduct systematic review as far as health policy and health system research are concerned.
Now you've just won a grant from the Alliance for Health Policy and Systems Research to do some work on sector-wide policy making. Tell us how you intend to apply that support.
The support from the Alliance will help us to build capacity within our policy maker in Cameroon, mainly because Cameroon is moving towards a swap with the support of the World Bank, the German cooperation and the French cooperation. A unit has been set to steer this whole process, and this unit is missing capacity in terms of using evidence for decision making. So we'll typically support this unit, providing them with training in how to use, how to assess the evidence, also providing them with policy briefs on some of the topics that are critical when we are moving towards decentralization of the health sectors.
Tell us just a little bit about SWAP first.
So the sector-wide approach, it's a tools that is recommended to improve the implementation of some of the recommendations by the Paris Declaration on the effectiveness of health for development. Aid for development. Okay. The SWAP approach is a sector-wide approach that is a mechanism to improve alignment and harmonization in the way development aid is being used. Since 2006 that Cameroon decided to move toward a SWAP as to implement the Paris Declaration on the effectiveness of development aid.
Okay, and in the case of health, there's capacity lacking at the ministerial level to implement this, is that right?
Yes, that's right, that to implement the SWAP, it can be considered as a revolution for many of the countries when they have been working in silos with many vertical programs, with diverse procedure by different type of donors. So the SWAP approach is really trying to bring together a lot of actors, trying to ask them to have the same type of procedures, trying to harmonize the way they are collecting the funds, the way they are planning to use it, moving from a project management to a more sector vision that will help to increase the effectiveness of the money that's been allocated for health in Cameroon. And in terms of making the right decision, increasing the efficiency of the resource allocation, we need to make the right choice, as we are also moving for another challenge, that is decentralization in a country that has been very centralized.
But the alliance is to do with research. I mean, what does this have to do with research, etc.?
Yes, what this alliance is about health system and health policy research. Yeah. So the SWAP is a concept, it's theoretical, but you need to see how it's work on the ground. So it's something interesting for us that the alliance decided to support the evidence to policy activities, trying to build national mechanism in this particular area to increase knowledge translation and exchange and utilization in the policy decision making, that the money from Alliance will be helpful.
So you're going to try to train the relevant staff in the ministry to make use of evidence. Where are they going to get that evidence from?
So we are planning first to build capacity for the staff in the ministry in terms of assessing, collecting and using evidence. We will manage to use some of the tools that are available globally, and for the evidence utilization we'll need to adapt it. So we are planning to write some policy brief building on the global evidence, but also on the collection of great literature that is available from the evaluation, from some situation analysis that have been done in Cameroon, and trying to package this and see how we can build new governance arrangement, new regulation, new guidelines for the staff at the district level to better deal with the decentralization process and selecting the right information. We also build on improvement of the utilization of the health information, the routine health information system that have been collected at the district level.
Because you're going to focus on decentralization. That's the
the swap
and community involvement.
The swap in Cameroon has as a main goal to decentralize and improve the district. So we need to strengthen our health district system. So typically is increasing the capacity for the district management team to deal with the community in terms of improving governance, being sure that the decision and the intervention that are being provided are equitable, and then we'll have one policy brief will look at local governance, the second one at utilization of routine health information, the third one will deal with community participation, and the fourth one will deal with community health insurance scheme that have been promoted in Cameroon.
Right. If we take one example of those, if we take the community involvement, that's becoming increasingly important to relate. It's becoming increasingly important to relate to the community in providing them with information from research, I believe.
So, for example, the one on the community participation, as you may recall, community participation has been since the Alma-Ata Declaration seen as in something that will help to improve democracy. And but at the end of the day, the community getting involved in health is a completely shifting of the paradigm, where you have healthcare provider bringing services to the community without their own opinion. Then we need to see how bureaucrats will deal with the community in a sort of real well-balanced partnership. So it's important for us to see what are the mechanisms that improve the efficiency of community participation in order to avoid a biased community participation where the leaders that will be representing the community will not do their real job and become a part of the system instead of being there to voice the needs of the community and be there to improve or increase the accountability of the whole system.
Okay. Now, the Alliance is not a big donor, and this is not a particularly large grant. How do you see the impact of this in the long term? Is this a seed for new things? I mean,
So the money for the Alliance will be seed funds, because as we will be introducing the process, we are really convinced, we may be dreaming, but we are really convinced that by introducing this, we'll convince the donors who are part of the swap to put aside more money to be sure that the evidence-informed processes will be the rule in the whole implementation of the swap in Cameroon. So this is our dream, getting the money from the Alliance to convince some of the donors intervening in Cameroon that the right way of doing it is to inform any single decision-making process of choice of strategies by the units.
Well, good luck and good work, Pierre. Thank you very much.
Thank you.
Lucy, you have a grant from the Alliance for Health Policy and Systems Research. What's that for exactly?
Well, it's a grant that will support the development of syntheses of policy analysis work that looks at the processes of policy development and implementation. It will allow us to develop some methods for doing synthesis of existing work in this field. It's there is now quite a lot of interest in knowledge synthesis and in methods of synthesis, but they haven't yet really been applied, certainly for low and middle income countries, to the synthesis of more qualitative research. And so this is innovative because we will be looking at qualitative research, and it's innovative because we will particularly be looking at work that investigates how policies are brought about, how agendas are set, and as importantly, how they're implemented.
Okay. That sounds rather abstract. I mean, do you have some specific policies you'll be looking at?
Well, the field of this work is actually quite limited. So there is a body of work that spans from looking at HIV/AIDS policies, which themselves are many, to financing policies, which would encompass user fees, health insurance, and other types of policies. So we need to look at what the field is to determine that there's enough material to do some synthesis around. I think that our focus is, of course, the work on particular policies or particular interventions is important, but our focus is also on questions like how do you set agendas for any policy? How do you strengthen processes of implementation for any policy? So the questions of focus will not only be policy specific, they will be cross-cutting.
Mm-hmm. And are they likely to have any impact on policy making in South Africa?
Well, the work is not particular to South Africa. It is intended to be using an international body of material. And I think there are two answers. One is that by synthesizing knowledge, by synthesizing existing evidence, we are seeking to distill the key essences of that evidence in ways that then become easier to discuss or to transmit to policymakers.
Okay. So which policymakers do you have in mind? I mean, you're talking about international policymakers, the bank, the big donors and so on.
Well, not entirely. I think some of the work is relevant to them, but some of the work will also be relevant to national policymakers, and some will be relevant to managers within countries as well, because it's that whole food chain of people who are involved in policy development and implementation.
How big is the grant? I mean, financially speaking.
It's to be honest, I think it's just over $150,000 US.
Okay, so it's not a lot of money. So it's seed funding, isn't it? So where does that take you?
Well, it's seed funding to do something that is a bit unusual, that is otherwise difficult to get funding for. So it takes us a first step of thinking about how to do this work, perhaps of concentrating on one or two key questions, that then provides us with a platform for expanding the range of questions we look at. So it is exploratory work in some way, and that's what seed funding is good for.
Okay. Lucy, we just had a meeting in Bamako here, a round table, discussing the priorities for health research in health systems research. What were the conclusions?
Well, there was quite a wide range of topics discussed, ranging from human resources, financing, intersectoral action, community participation, and each of those areas generated 2 to 3 research priorities. I think what was really good about the session was that there was an opportunity for people to discuss, to talk to each other, to focus on a particular issue, to have debate, and that's really an important thing within the context of the Global Forum as a whole.
Right, so the debate around the table was possibly even more important than the conclusions that were reached.
In some ways, I think there were some good conclusions coming out, as far as I could tell from the different sessions, in the sense good of clear conclusions that then provide the clear messages. But I think also the debate around them is important.
Okay. But can you pick out one or two research recommendations that strike you as being novel or important?
Well, I think there was a group looking at issues to do with community participation, and amongst their conclusions, in fact, they said we didn't come up with final research question priorities, but they came up with conclusions around research issues to do with community participation. Two things they said were, firstly, that the types of questions that are generated need to be developed with communities as opposed to imposed on communities. And secondly, that it was slightly disappointing that in this session we had one Minister of Health but not the other Ministers of Health to be a part of the debate. So I thought those were two important points to mention.
Okay, though the Minister here did promise to take it all back to the ministerial session.
He did, and the Minister of Health from Namibia has been very active in the session and clearly engaged with the idea, so that was great.
Okay. Irene, you're Regional Director for Health Services in Accra. Now, you believe that health systems research has real value for your work in caring for the health of that region. Could you give me a couple of examples?
Yes, and I'll start with the most recent because it's always easier to remember the most recent. If you take something like maternal mortality, it's one of our major challenges. How do we reduce maternal mortality? And we've been looking at it on the community and then within our institutions. And within our institutions, over the last 4 or 5 years, we've kept looking at the data, on the women who die in relation to the women who are referred there. And, some of the hospitals just don't seem to be able to drive down their rates. And we kept wondering, what is the issue? Then I saw an impact study where they actually did an inquiry into maternal deaths. This was research. And they found from their inquiry that, when you go into the reasons why the women died, in fact, it wasn't, the tools and equipment are not the best, the infrastructure is not the best, but the core of it was also issues around provider attitudes, provider competence, and in fact, I remember I called the impact team, in fact, with your help actually, and said, I don't get this finding. Are you trying to say that we have enough of everything? And they said, no, it's not that you have enough of everything, but our research shows that despite the fact that you don't have enough of everything, with what you have, you could save more lives than you are saving. Now, that is something which may not necessarily have been intuitive, but with that finding, in fact, I've called a regional maternal mortality conference. I invited the private sector, the teaching hospital, the government hospitals, and in fact we titled it Understand, Forgive and Remember, and said, let's discuss this issue again. And in fact we realized, yes, everybody was frank because of the way we titled it. Yes, we do have an issue with...
Irene, so what were these research results on maternal mortality exactly?
Well, it was part of the impact study. I was reading the papers. In fact, I read the impact policy brief, courtesy you actually, and I saw this little bit where they said that a major driver of mortality was not the lack of essential equipment to...
Keep going.
Was not the lack of essential equipment, tools and supplies, but it was rather provider attitudes, provider competence. And I thought, that's an interesting finding. That's not the way we are thinking. So then I kind of asked the team, again with your help, you put me in contact with them, that, can you explain this finding a little further? So from that policy brief, they sent me the papers and I actually read them. And then it clicked because they from their inquiries, it wasn't that the equipment situation was perfect or the medicine situation was perfect, but that even in those imperfections, deaths were occurring which could have been avoided if provider competence was better, provider attitudes were more positive. And it was like a light going on that this research, this is useful. So in fact, as a follow-up, I have already called a meeting in the region. I didn't mention the research results, because then maybe people get uptight. I just said, let's call this meeting Understand, Forgive and Remember. So then we all openly start discussing the issues. And in fact, it does come out, that, in fact, for example, I remember at the meeting, people, because everybody was there, those who refer, those who receive the referrals from the teaching hospital, and then some of those who refer say, when we refer cases to you in the teaching hospital, they are turned away by the watchman at the gates, that all the beds are full, go away. And the doctor says, but I never know that. They say, well, they are being turned away without you ever seeing them. And I don't want to go on and on, but I'm just saying that was a piece of research that has now triggered off something we are doing. And
That's excellent. That's very interesting. So that actually requires not only the research but also a little bit of knowledge translation, doesn't it?
yeah, it does, and that's where I think, in fact, right now it's a major area of capacity building, because if you take, I'm now a health system manager, to an extent a bit of a policy maker, but I was a researcher before I stepped into that role. So for me, it comes naturally to be curious, to want to see research findings, to want to use research findings. And I think we need to go out there and systematically build, as part of knowledge translation, get managers, policymakers, just to understand a bit better the potential of the research, and then also to get researchers to also communicate better their results. Because if you take this example I gave, I really came about it a roundabout route. You sent me the policy brief, and then reading it, it's like, I want to know more, and then you linked me back to the researchers.
You need something a little bit more systematic.
This was a bit informal. You need a more systematic method of knowledge translation, yes, and much more health systems research.
Brilliant.